Final thing, what does the procedure time look like? Is there a hospital stay expected? And in physical therapy, what does that look like for somebody?
So in general, these are outpatient surgeries. Arthroscopic rotator cuff repairs are performed as an outpatient surgery with a nerve blockade. So your shoulder is numb, performed by the anesthesiologist. The surgery itself, from start to finish, is usually 35 to 45 minutes, maybe an hour at times. You go home the same day in a sling. Your pain control is dependent on how long the block lasts. Rotator cuffs have a bad rap in terms of how much pain they cause, and they do. And I don't try to cherry coat that with any of my patients. It's a painful surgery once the nerve block wears off. After a week, you come back to the office. Depending on what you had done specifically, there's a protocol set for that. That protocol will be carried out by a licensed physical therapist. Oftentimes with a repair, patient's going to be in a sling for the first 6 weeks, and I tell people just to survive that amount of time. It's boring. Don't do anything stupid during that time point and jeopardize the repair that was performed. After 6 weeks, the sling is off. You're able to perform range of motion as tolerated without lifting. Somewhere around 8 to 9 weeks is when the strengthening process begins. Anywhere from 3 to 4 months, patients come back in and say, I'm doing pretty well. I still know that I'm weak. And that strength will continue to improve up to a year after their rotator cuff repair.
Gotcha. Final thing. If someone sees this and they have been dealing with shoulder pain for more than a year, but they've kind of gotten by with it, it's not detrimental, it's not impairing them, impeding them from doing anything in their life, but it's painful, they don't sleep as well, what would you say to that patient to kind of say, like, it's going to improve your quality of life, whatever? What would you say to that patient?
Oftentimes patients do come in with chronic pain in their shoulders, and they wonder to themselves, it's livable. I can tolerate it. First and foremost is making a diagnosis. You can perfectly well live your life, but let's know a diagnosis, understanding what may be wrong first. Don't go get tons of treatment. Don't go get an injection by your primary care. Don't go do physical therapy. Make a diagnosis at some point. Once you know the diagnosis, that's 99% of how we can treat someone. If I know what's wrong with you, I can have an educated medical guess on what I think is going on inside of your shoulder, but until I'm convinced, based on usually an MRI scan, I don't want to lead you down a pathway of saying just ignore it, because there's a lot of people that ignore shoulder pain and have done so for years that may have a rotator cuff that is gradually getting worse versus years ago. If you'd gotten treatment for it, at least make a diagnosis, you could have stopped that progression of the tear from becoming irreparable. And tears can become irreparable over time. That's a problem I see all the time is people say, I hurt my shoulder 2 years ago, I fell on the ice. It got better, and I thought I was doing fine. Then when they finally come to see you 2 years later, an MRI scan shows that their rotator cuff is no longer reparable. And then you have other options such as shoulder replacement surgery that they didn't need as a 50-year-old. So it is important to make your diagnosis number one. If you've had shoulder pain for years, figure out what's wrong with you.
Gotcha. Perfect. I think that's
You want
all
to do
good.
a quick little, I don't know if you have this in mind, but like something like, the good news is that, over 85% of patients make a full recovery within a year or something. Do you have anything like
I don't know
that?
if there's a stat out there.
Okay.
Yeah, I don't think
It's
there.
always
Everybody's
good to
different. People are
include
so
something
different.
Like that,
I know.
or you could even say something like,
I-
most people make